Anything else with gestational?
It's risky for pregnancy outcomes.
What?
It's negative
Okay.
for pregnancy outcomes.
Increased risk for pregnancy.
Or for like poor birth outcomes.
Okay.
Sorry.
I got diabetes, I'm gonna get pregnant this weekend. There was my group is used to this. As an aside, there was a paper published by members of the dental school quite a while ago that looked at the old wives' tale that you would lose a tooth for every pregnancy you had, women. And so what they did was it was just set up to be a kind of a simple research project for a student to go in and monitor how many teeth female patients had lost and how many pregnancies they'd had, or children, how many children they had. And so they asked patients about, they could tell how many teeth the patient had lost, and then they'd ask them, well, how many children do you have? And so it was a simple little project. They put it together, and then they presented it or published it somewhere. And it got picked up by newspapers around the country. Just a little blurb that this research project shows that the old wives' tale, lose a tooth for each child you have, actually worked out pretty well, and this research supported that idea. But what they didn't ask was, did you lose the tooth after you had the child? That's kind of important information in terms of showing causal effects. And so I heard the student present the findings, and it was here in school at Professionals Day. I held off asking my question about, did you ask whether they lost the tooth before or after the child? I did ask that, but I didn't make my follow-up comment when they said, no, we didn't check that. Or as you learn to say when you present research findings and somebody asks you a question like that, that's a good question and we should follow up on that, but no, we did not. What I was thinking was I could take the same evidence they presented and say that our research shows that the fewer teeth a woman has, the more likely she is to get pregnant, right? They weren't making that argument at all. Okay, my aside is over now. So what else about gestational diabetes? Anything more? Okay. So, in terms of, and then pre-diabetes, you can put, what is pre-diabetes? I'm not going to write anything down there, but.
Pre-stage 2.
Huh?
Pre-stage 2.
Pre-stage 2?
Yeah.
Okay.
I think if I remember correctly, if you have a
Pre-type
a
2.
fasting
Pre-type 2.
glucose level of, is it between 120 and 140, or 100 and 120?
What should your fasting glucose level be?
100
100? What are units?
deciliters per
Deciliters?
Deciliters?
milliliter.
Who was it that told me? Somebody just told me how many grams of sugar are there in a 2-liter?
108.2.
108.2 grams. Yeah, we've got that up there, right? So, yeah. So hopefully that's not grams. That's probably in milligrams per 100 ml for glucose. So there are acceptable levels, and then if they start to climb up, did you go into what's going on? So you've got elevated glucose levels. Did you get into what's going on with that?
What do you mean?
Hopefully, well, actually, we'll cover that in a few minutes. Before we take our break, a quick question, or probably a couple. So pre-diabetes, we could put in, the different, what's a blood glucose level, what does this mean? To go from pre-diabetes, and then pre-diabetes predisposes us to type 1 or type 2 diabetes mellitus. We're on our way to heading there. What I did want to, my questions though, before we take our break, are what's diabetes insipidus? How many groups did not check out diabetes insipidus? What were you thinking?
It's rare.
It's rare? How rare? You got my statistics, come on. What is, we say diabetes and we're probably talking about type 1 or type 2.
It's more
Okay,
than 25,000.
especially probably dealing with type 2. 1 in what?
25,000.
1 in 25,000. So you're saying there's a chance. Okay? But how come when we say there's diabetes mellitus, that's what we're usually talking about when we say diabetes, but there's also diabetes insipidus. And what's the difference? What is diabetes insipidus? I'll say diabetes mellitus is a problem with insulin signaling.
Diabetes insipidus looks like an inability to modulate properly water levels in the body.
It's a problem with what kind of signaling? You can tell me in one long word, or actually two words, one of them long, or 3 letters.
ADH.
ADH, antidiuretic hormone. Okay? That has to do with reabsorption of water in the late distal convoluted tubule and throughout the collecting duct. Okay? And so we have 2 types of diabetes insipidus. One is called neurogenic or central. And there the issue is that we're not secreting ADH. So it's sort of like what type of diabetes mellitus? Type 1. And then we have nephrogenic, nephro for referring to the kidneys. And so now the cause is in the kidneys, and that we're not getting good signaling because for one reason or another, we're not making the receptors for ADH. So we can't say anti-diuretic hormone. What does diuresis mean?
Excretion of water.
To lose water. So anti-diuretic hormone would be keeping us from losing water. So with diabetes insipidus, we'll have polyuria.
It was from increased retention of sodium ions in the tubules so that you bring in more water and you're excreting more water.
Well, that can contribute, but not for diabetes insipidus. That would be a problem with aldosterone, a different hormone from a different place. Okay? So nephrogenic is we don't have the receptors. So nephrogenic diabetes insipidus would be similar to what type of diabetes mellitus? Type 2, where we're lacking receptors. Okay? So how come both of them are named diabetes if one is a problem with glucose and insulin and the other is a problem with water and ADH? Why do they both get named diabetes? What does diabetes refer to? The elevation of urine production. Okay? That's what diabetes actually is meaning. Diabetes mellitus. What does a mellitus? What does that mean? Sweet. So diabetes mellitus, the issue is we're losing glucose in the urine. The urine part, that's the diabetes. The glucose part, that's the mellitus. And so glucose acts as an osmotic diuretic, diuresis to lose water. So the presence of insulin, or of glucose in the urine is pulling water out of the body, preventing it from being reabsorbed as much as normal. Diabetes insipidus, the problem is we're not able to use the osmotic gradient that's present in the renal medulla to suck the water back into the body. Because ADH would be responsible for putting things called aquaporins into the membrane to allow us to suck the water back in. So we start to think diabetes is referring to sugar in the urine. No, the mellitus part does that. Okay, let's take a break, and when we come back, we'll look at insulin signaling, the whys and the hows.
Can I look at your comment for type 1? I don't think I read about that.